Hello, my name is Dr. Natashailako. I am a board-certified plastic surgeon here in Nairobi, Kenya. And today we're going to talk about a Lipo 360 or a tummy tuck. Which procedure is right for you? Lipo 360 is a procedure that aims to improve the overall figure by removing fat from the waist, the lower back, upper back, and the love handles through liposuction, which is where we use long tubes to extract fat from the body. Lipo 360 contours the entire midsection in 360 degrees to provide smooth contours all around the waistline for that sculpted look. However, Lipo 360 is only for fat removal. It does not deal with excess skin. Tummy tucks, also known as abdominoplasties, are designed to eliminate excess or sagging skin in the abdomen, as well as fat, to restore that youthful appearance to the tummy. Tummy tucks do not only remove the excess fat and skin, there's also muscle tightening or the repair of the underlying abdominal muscles that may be affected by diastasis recti, which is a separation that occurs in the midline of the abdominal muscles, especially after pregnancy. So how do we decide on which procedure is best for you? If you have excessive or sagging skin or diastasis recti, a tummy tuck is usually recommended. If you have tight abdominal skin of good quality without excess skin or sagging or diastasis recti, a Lipo 360 is recommended. However, a consultation with your plastic surgeon that includes a physical examination is key for making this decision. If you'd like more information, reach out and find out what procedure suits you best. Till next time.